Hi everyone, I'm Dr. Shilpa consultant neurologist, Medicover Hospitals, Chandanagar, Hyderabad. So I'm here to talk about chronic fatigue syndrome. So what is chronic fatigue syndrome? Chronic fatigue syndrome is a complex multi-system disease or a disorder wherein the patient will experience a variety of symptoms. So to begin with, there will be a lot of unexplained fatigue. Patient will have fatigue and there will not be any medical illness that can attribute to the fatigue. For example, we see fatigue in patients who are having uncontrolled diabetes or thyroid issues or patient who have addictions. But patient not having any comorbid conditions or any medical ailments can experience this unexplained severe fatigue. So in chronic fatigue syndrome, apart from fatigue, the patient can also experience other symptoms like difficulty in falling asleep, difficulty in maintaining a sleep, insomnia, or a lot of malaise. Even with normal activity or exercise, there will be a lot of fatigue and malaise as well. There will be other difficulties that will impair the quality of life, wherein he or she can experience difficulty in concentrating and memory lapses, memory disturbances. And this can also interfere with the cognitive abilities, that is the decision making, the attention and concentration issues of the patient. Apart from this, there can be other physical symptoms that a patient can experience. For example, the patient can have muscle aches or joint aches that can be constant or that can be variable. Apart from this, the patient can also experience some sore throat or difficulty in swallowing, swollen lymph nodes, uneasiness or a sensation of lump in the throat. So apart from the psychosomatic complaints, there can be physical complaints also that can impair the quality of life. So why is this important? As I said, there is no medical illness that can attribute or that can contribute to this kind of symptoms. But still the patient end up suffering having two or more than two of whatever symptoms I have mentioned, and this can occur across various age groups. So what do we do? So first and foremost is to exclude all the organic or medical disorders, if at all any, in one particular patient. So immediately consult your physician or neurophysician and we'll see if there is any treatable condition that is attributing to these kind of symptoms. Followed by if there is nothing, then yes, this could be a probable case of chronic fatigue syndrome. So chronic fatigue syndrome, what do we do about it? So like other diseases, this is a condition wherein we need lot of lifestyle changes. So stress management, diet, sleep, and the changes in the circadian rhythm that can occur in certain IT professionals or software employees that can result in sleeplessness or insomnia. So any underlying non-organic disorder that has been causing these kind of symptoms has to be corrected. Plus, still if the patient is experiencing these kind of symptoms that are hampering with the day-to-day activity, then we add certain pharmacological treatment options that will make the patient's life better. So I would say patient who is experiencing these kind of symptoms, whether it is man or women, or this can occur in adolescents as well, considering the shift in the lifestyle and the sedentary lifestyle that has been observed in the past 1 or 2 decades, this incidence and prevalence when it comes to chronic fatigue syndrome and fibromyalgia overlap. These are the conditions which we see day in day out in our neuropathies. These can be diagnosed, addressed and treated, if not cured, permanently. So the permanent cure is what we see is in less than 10% of the patients, but to a large extent we can treat the symptoms and we can improve the quality of life. Thank you.